November is Lung Cancer Awareness Month, and doctors and those affected by lung cancer firsthand are warning you need to get screened, even if you don't think that you're at risk. WFMY News 2's Sydney Moore shares two women's stories.
Side by side,
we've done plenty of things together.
Shantae and Lawana Leak were more than sisters. They were best friends.
Lawana was just a sweet person, kind, giving.
Their bond blossomed through the years, from little kids to parents themselves.
A terrific aunt, best aunt ever.
Shantae Leak loves talking about her sister, but she can't talk to her. In 2018, Lawana Leak was diagnosed with lung cancer. She passed away this year.
Started out with a constant cough and then some shortness of breath.
The diagnosis, a shock to the family. Lawana never smoked.
I did not have any idea that you could get lung cancer without being a smoker.
The entire family stayed by their loved one's side, often going to oncologist appointments.
They do check your environment to see if you had been around anything, I guess, that would contribute to it. But that was about all we had. Was the she don't really be around secondhand smoke.
So many questions unanswered. Another triad woman knows all too well what it was like. Lynn Sametz was friends with Lawana Leak.
She was elegant through the process.
In 2017, doctors diagnosed Sametz with lung cancer. She didn't smoke either.
I have no risk factors. I'm healthy. I eat a great diet. I exercise.
Like Lawana Leak, Sametz went through several rounds of treatment. The cancer controlled but not gone. She developed a genetic mutation, which means a change in DNA.
I had radiation and I was fine for 2.5 years. But I have a mutation, as I said, and they come back. I mean, until we can pluck it out.
These days, both Shantae Leak and Lynn Sametz take time spreading awareness about lung cancer.
When you feel any type of way that's including shortness of breath and a chronic cough, please request a chest x-ray.
In hopes to save a life. In Guilford County, Sydney Moore, WFMY News 2.
We just heard two people's very personal experiences with lung cancer. To talk more about lung cancer and the importance of early detection of who is at risk, with us today on To Your Wellbeing is Dr. Mohamed, a thoracic medical oncologist with Cone Health Cancer Center, and he is an expert in the lung cancer field. All right, doctor, so first and foremost, I mean, we saw two women's stories. Who is at risk for lung cancer?
Everyone is at risk for lung cancer. We always think of lung cancer as a cancer of smokers, but unfortunately we have been seeing a lot of non-smokers presenting with lung cancer. 80% of the patients we diagnose with lung cancer are either a smoker or former smoker, but also put on perspective that 60% of the patients that we see with lung cancer are either former smoker or never smoker. So lung cancer can affect anyone, can happen in anyone regardless of age and regardless of the smoking status.
All right, now we just saw two women's stories. Do we see more men or more women with lung cancer?
Until recently, it was more common in men. Actually, the odd of having lung cancer is 1 to 15 in men and 1 to 17 in women. But I was actually reviewing the statistic for this year, and I noticed that there will be more women diagnosed with lung cancer in 2023, almost 119,000 compared to 118,000 men. So the shift actually going more towards women these days.
All right, and then we kind of wonder, why is that? And especially when we hear, these particular two women, they did not smoke beforehand, and a lot of non-smokers are getting lung cancer. So let's talk about, how does that happen?
Yes, non-smoker can get lung cancer from many other factors. Actually, secondhand smoking is a big deal. There are almost 7,000 deaths from lung cancer in secondhand smoker. Radon, which is a colorless, odorless gas that could be present in any of our houses, also can go undetected, and it's a cause for lung cancer. It's actually responsible for around 20,000 deaths from lung cancer every year. The air pollution is a factor in lung cancer. Um, it's interesting that there was some sex-specific study noticed that women, especially at younger age, premenopausal women, who smoke are 3 times higher risk than men of getting lung cancer because there are some enzyme polymorphism. I don't like to go into more technical details, but these women cannot really detoxify the toxins in cigarette as men, and the sex hormones are responsible for part of that. There was also a very interesting study. It was a heart study that was giving men estrogen to decrease the risk for heart disease. That study actually was discontinued earlier, stopped earlier, because they noticed that the arm of men who were receiving female sex hormone were getting much higher risk of lung cancer compared to the other group.
Interesting. Okay. So what about someone who maybe quit smoking years ago? How concerned should they be?
Again, everyone is still at risk for lung cancer, whether they smoke or not. There is no zero level of avoiding lung cancer. We always recommend screening for lung cancer, especially for people who has a history of smoking in the past. Actually, the recommendation and guideline now are getting much better because they allow people from age 50 to age 80 to get screening for lung cancer if they have a history of smoking around 20 back a year. It used to be 30 back a year. And just let me explain what it means back a year. If you smoke 1 pack of cigarette for 20 years, you qualify. If you smoke 2 packs of cigarette for 10 years, you qualify. So it's the number of packs by the number of years. And if you fit 20 back year history, you qualify for screening as long you still a current smoker, quit smoking within 15 years.